Well, despite the availability of the vaccines, the medical professions are beginning to warn that we may have to live with COVID for some time to come. Joining us now to discuss this new normal is Dr. Christopher Colbert, Assistant Program Director of Emergency Medicine at the University of Illinois Hospital. Doctor, thanks for being with us. So you argue this is the new normal, that COVID is going to be with us here in the long term. What exactly does that mean?
I do. I think we're at a point where we need to recenter this conversation to how both you and I can go through our day with our families at work and still contribute and have a great and quality events, whether it's family events or school events, and still be safe. And so this is the transitional conversation we need to have, to understand that you will have to wear a mask and decrease your occupancy, meaning that events, so that you can decrease the transmissibility of Omicron, so that collectively we can continue to have specific events, i.e. high school games, work events as well, as long as we abide by specific policies to decrease the effects of COVID-19.
Doctor, will everybody get it?
Will everybody get the vaccine? I ask myself that every time I go into work. It's my recommendation.
But will everybody get COVID, I guess is my question. Will everyone eventually get COVID?
It's looking like a vast majority of individuals will receive and have COVID without question. Can I say everyone? Absolutely not. Do I say a vast majority? 100%. We see record numbers of individuals, both adults and pediatric patients, present to the emergency room now that are COVID positive. At one point early in this pandemic, I remember seeing very few peds cases, and now we have an increase in pediatric cases as well. But that being said, with the recommendations, vaccines, boosters, and certain policies put in place, we can manage this as best we possibly can.
We saw just today, Doctor, the Supreme Court dealing a blow to the Biden administration, requiring large private companies to mandate vaccines for their employees. Do you think that more public places will go forward doing this on their own to require, restaurants, bars, places like that?
As it looks right now, it looks like a lot of states, a lot of restaurants are making this consideration because these numbers reflect the transmissibility and the devastating effect that it's having not only on hospitals, but other restaurants as well, other places of business, because those places of businesses have less employees because of sickness secondary to Omicron as well. So getting a hold of this, a part of that is mitigating the spread. And part of that is by stating, hey, we're going to draw a line in the sand and demand individuals participate as they should with shared responsibility of wearing a mask, receiving the vaccine. And if you choose not to participate in these, to mind that other people have these concerns and to remain at home.
Doctor, do you believe that COVID will become a part of our lives like measles, the flu, pneumonia? Is it something we'll be with forever?
COVID is already a part of our lives. I do not believe COVID will leave. And I believe this is something, again, that we can honestly address and move forward as long as we get a vast majority of individuals to buy into shared responsibility. And from there, we can move forward.
Dr. Colbert, thank you so much. Be safe, be well.
You as well.
Still to come.